Leaked documents reveal a concerning exodus of psychiatrists from the Sydney Local Health District, SLHD, encompassing Royal Prince Alfred and Concord Hospitals, two major psychiatric centers. More than half of the district's staff psychiatrists have resigned, prompting serious concerns about the capacity to provide adequate mental health care. These resignations are not simply a matter of individual choices. They reflect a systemic crisis within the mental health system, exacerbated by chronic understaffing, overwhelming workloads, and inadequate support for healthcare professionals. The documents also outline plans to maintain existing services, despite the significant staff shortages. This strategy relies heavily on bolstering the allied healthcare staff and nurses, placing an even greater burden on already. The effectiveness of this approach remains highly questionable, given the scale of the psychiatrist departures and the inherent limitations of non-physician staff in managing complex psychiatric cases. The potential for compromised patient care and safety is a significant and urgent worry. One document, an action plan for staff well-being within the SLHD, proposes talking points for interactions with patients. These talking points aim to de-escalate potentially volatile situations, uphold organizational values, and manage patient expectations amidst the staffing crisis. The carefully crafted language emphasizes that care remains unchanged, despite the visible alterations in service delivery. Phrases such as "you will be cared for," "services are not being closed," and "there may be delays" attempt to reassure patients while subtly acknowledging the significant changes. The inclusion of the phrase, "you will not be missed," though potentially well-intentioned in attempting to manage patient expectations, highlights the immense strain and potential for miscommunication within the system. The clinical implications of such phrasing, particularly concerning the potential for harm to already vulnerable patients, are troubling. The casual use of the word "missed" within the context of patient care further points to the lack of sensitivity training among management and staff. Dr. Jackie Huber, the chair of the Australia and New Zealand Emergency Psychiatry Network, points out that prolonged stays in emergency departments for psychiatric patients have been a persistent problem across New South Wales for years. She asserts that the mass resignation of psychiatrists will undoubtedly lead to a significant increase in the length of these stays, exacerbating an already dire situation. The consequences of this prolonged ED stay include a lack of access to specialist psychiatric care, reduced quality of care, and the creation of further stress among the already overstretched ED medical teams. The potential impact on both the mental and physical health of affected patients is significant. Jonathan Harms, CEO of Mental Health Carers NSW, cites federal government data indicating that seeking mental health assessments in emergency departments is already the most common pathway for individuals in need, yet a significant percentage of these individuals do not receive the necessary care. This statistic underscores a critical failure within the system, where access to timely and appropriate mental health care remains severely limited. The ongoing shortage of psychiatrists, coupled with the already high demand, creates a perfect storm, with devastating consequences for individuals struggling with mental health issues. The systematic failures outlined clearly demonstrate a need for immediate and significant reform, not merely reactive measures to maintain the status quo. The sheer scale of the psychiatrist resignations exposes deep-seated flaws within the mental health system. The emphasis on maintaining services without addressing the underlying cause, the profound staff shortage, points towards a short-sighted and potentially dangerous approach. The plan's reliance on bolstered, allied healthcare professionals, without addressing the core issue of psychiatrist attrition, risks overburdening these professionals and potentially compromising the quality of care provided to some of the most vulnerable members of society. This crisis requires a multi-pronged approach, including increased investment in mental health services, improved working conditions for mental health professionals, and a fundamental shift in how mental health care is prioritized and delivered within the system. Failure to address these issues effectively will only lead to further deterioration of mental health services and exacerbate the suffering of those who rely on them. the potential for long-term negative consequences, including increases in self-harm and suicide rates, is alarming and cannot be ignored. The crisis requires immediate and decisive action from all levels of government and stakeholders to avert a catastrophic collapse of the mental health system.